Hello, here is a baby born by normal vaginal delivery weighing 4 kilos. The extraction was done, it was a difficult extraction, long labor, used instrumentation to deliver. At birth, baby cried immediately after birth. Apgar score was normal 8 and 9, and it is baby noticed to have paucity of movement of the limb. You can see the right upper limb, baby is kept close to the chest, and you can see how, and this is adducted at the shoulder joint, internal rotated, extended at the elbow, and you can see that there is a flexion at the wrist joint. So that means to say that lateral rotators and abductors of the shoulder, and you can see flexors of the forelimb and extensors of the wrist, they are affected. And this is what we call technically, it is a brachial plexus palsy. Perinatal brachial plexus palsy, the term used. And always when such babies are born, we need to look at the important risk factors. It was a difficult extraction, prolonged labor, instrumentation, and other things always you need to keep in mind is maternal diabetes, common reason. And always ask for Apgar score because associated perinatal asphyxia also should be ruled out. And whenever we deal with brachial plexus injury, make sure that no bone is injured, especially the humerus and the clavicle. Breech presentation also can manifest like this. Always better to look for the hips and see whether the baby is active, baby is pale, especially when there is fracture, big bone fractures, baby will be either in pale or in shock. So always vital monitoring is very important in such babies. Once you see that baby is comfortable, if you look at this baby is very comfortable, and also look for baby whether baby requires any respiratory support. Sometimes brachial plexus injury will be associated with phrenic nerve involvement. If there is asymmetry of the chest movement with aspiration, that is one. Always look for if there is any drooping of the eyelid, because Horner syndrome. So any brachial plexus, look for phrenic nerve involvement, indicating the chest asymmetrical excursion. Look for drooping of the eyelid, and always look for the head. Sometimes they'll have cephalometoma. In this case, there is cephalometoma. So cephalometoma, sometimes caput, and also you'll find sometimes subgaleal hematomas. So look for all these things. So if nothing is there, a simple brachial plexus injury, it's better. And again, depending on the extent of brachial plexus injury, the treatment modalities also will vary. The simple observation to physiotherapy to the nerve grafting. That's how it goes. And here multidisciplinary team, neurologist, orthopedician and neonatologist will be involved. And parental counseling is very important, especially something injury happens, birth injury, always the parental counseling is essential component in the management of this baby. So here we involve the orthopedician, and he said to observe, and physiotherapies have been taught to the parents, and again after a month baby will be reviewed and follow-up clinics, we see how the baby improves. Are you clear about this? Thank you.